Hi, welcome to the Faculty of Science Freshman Welcome Day. This is LT27. Please take a seat as our program will commence shortly. Good afternoon and welcome to the NUS Faculty of Science. My name is Zhi-En, a Year 4 chemistry student, and I'll be your MC for today. Want to learn more about the journey to become a pharmacist? In this talk, Associate Professor Chui Wai Kiong will be sharing about managing your 4-year journey and developing a professional identity. Prof. Chui is a member of the Singapore Pharmacy Council and co-leads the design and implementation of the Bachelor of Pharmacy program. He also sits on working committees in the World Health Organization and the Western Pacific Pharmaceutical Forum. Prof. Chui, please.
Thank you. Thank you so much. Very good afternoon to one and all, and welcome to the National University of Singapore. And in particular, the Department of Pharmacy would like to also welcome you to this Faculty Welcome Day. All right, so again, welcome aboard. Just like to first of all congratulate all of you for making really quite an important milestone in your life history, that you're now all coming into the university, all right, getting a university degree. And of course, you have specifically applied to read pharmacy, and that's really something that it's not an easy course to get into, all right? And I'm happy that I see so many of you, even though not the whole class is here. And I hope that what I'm going to be sharing with you today, right, will give you a little bit more information as to what you would expect in the coming weeks, and also gearing towards the orientation week as well as the induction week before your proper classes will commence. Okay? So welcome again. Let me tell you a little bit about myself. So I've been here for quite a long time already. All right, you can see here my first degree was also Bachelor of Science, Pharmacy. In fact, I got my degree from NUS, the same department as where you're starting off, all right, and that was many years ago. And after that, I went to do a PhD in medicinal chemistry in the UK. All right, I then got myself registered as a pharmacist. So now I'm still a registered pharmacist, even though I'm not practicing at the hospital or in the retail pharmacy, but I'm what we call an academic pharmacist. That means I'm involved in research and teaching. So as you can see here, my area of interest is in drug discovery and educational research. And because of my interest in educational research, and that's where, together with myself, Professor Paul Gallagher, who can't make it today because he's on annual leave, both of us, in fact, have put together this new program, which is the Bachelor of Pharmacy, all right, which distinguishes it from the other program, the Bachelor of Science Pharmacy. And you will learn a little bit more about how different it is, all right? I mean, the main thing is that it's more integrated. You probably also have heard from your seniors, right? How many of you went to the camp or participated in the camp? Oh, good. Okay, I see a lot of hands. So by now you should know each other, all right? So that's a time where you actually foster friendship and also learn a little bit more about who you'll be studying together with. All right, so those are really basically, all right, you come into this new program and we'll share with you a little bit more in the next, in the weeks to come. Okay. Now, I think you've been through a lot of talks before you decided to put pharmacy as one of the options in your application. And you've probably heard a lot about pharmacy, like in medicine, in dentistry, right? It all leads you to, all these programs will lead you to the healthcare sector, all right? I think many of you are really aspiring to do that. And of course, during those talks, you hear about pharmacy being a professional program. And what does that really mean? All right, it really means that when you go through this program, at the end of it, you get a degree, and that degree allows you to become a registered pharmacist. All right, so in other words, the program that you go through is kind of recognized by the Singapore Pharmacy Council for registration. Okay, so that's for, you find that In the pharmacy program, like any other healthcare program, it's a little bit more structured. All right? It's not like the Pharm Science program, which is a little bit more flexible. Okay? So basically, as you go through this education, we're trying to equip you with all the competencies in terms of knowledge, skills, and also attitude to provide relevant professional activities. And what are these professional activities? Basically, what you will be doing will be helping some of the less fortunate, all right, people who are sick. And your expertise is in handling the medication. All right, so as a pharmacist, you're kind of like the expert in all the medications, all the way from you will learn about how drugs have been discovered, how drugs have been made into different dosage forms, how do you use them, patients have allergic reaction, how do you substitute, right? The whole range of all these professional activities, all right? You will learn how to do it, and you will learn to do this well, all right? So that you gain that confidence from your patients. And of course, at the end of the day, all right, you need to be registered first before you can practice. So really, this journey, all right, I'd just like to add also the beginning of this journey, and along the way, all right, you will not be alone, all right? You will have your course mates with you. You will also have all the professors with you, helping you along the way, all right? So don't feel like you're going to come into this program all by yourself and alone, all right? It can be quite a struggle, because I can tell you for now, really the program is not simple. There's a lot to learn, there's a lot to remember, there's a lot to apply, okay? So we have a lot of support system along the way to help you along. Once you get into the program, you're already a student pharmacist. Almost there, almost a pharmacist, but a student pharmacist or a pharmacist in training. Okay, so we want you to acquire the kind of identity, and that's why at the beginning, we like you to develop the professional identity, right? That I'm a pharmacy student or a student pharmacist. Don't feel shy about that. Shout it out. Okay? All right? Develop the identity, because that's really important. That's really important to you, to us, to the profession. Okay? So that's actually the beginning of the whole journey. And of course here, get acquainted with the reason and motivation to learn. So I'd like to share with you that once you get into a professional program, like any of this healthcare program, it's not about taking another exam. It's not about taking the O level. It's not about taking the A levels or taking the IB exam, right? You're actually learning for a particular reason. You're learning to make sure that you're competent to help patients, right? So that is the first thing that you need to really kind of organize your wires up here, all right? That's my learning goal, all right? Not only, I know grades to many of you are important. I mean, I can't say that that's not important, but I think you need to look beyond the grades, all right? And think about, whatever I'm learning, right? I'm actually learning to help my patient. It's also about learning to help yourself, because if you are sick, you know how to look after yourself. That's what we call self-care. All right? You want to learn also to help your loved ones, your family members. Okay? So that learning objectives is different. Huh? It's not taking A levels. So don't come to me and ask me, I want practice questions. That's not the whole idea here. All right? The whole idea here, you need to change the kind of mindset that I'm going to be somebody who is an expert in medication, and I can help people who need help with their medication. Okay? And another thing that you need to also learn to acquire is how you learn by yourself, right? We are not like your school teachers anymore, right? We don't tell you, oh, you must learn this. This is important. Memorize this, right? You need to learn for yourself, because in the future, when you're practicing or as an adult learner, all right, there won't be a lecturer anymore. You might need to go and read up from a book or read up from journal papers, for example. All right? So learning by yourself is important. But we know that that can be hard in your first year at the university, so we put you in teams. Okay? So when you come into the year, first day in the pharmacy program, we are already going to put you into teams. and you learn to establish a relationship with the team members, and you learn to support each other, all right, and learn with each other. That's where, one person, you've got to read 3 chapters within a short time, it's really quite impossible, all right? If you distribute the work out, and then you come together to discuss, right, you learn better, you learn faster. Okay? So along the way, what we are trying to do is to start establishing those foundations, all right, to help you build those foundational bricks in knowledge, skills, and attitude. And along the way, you will be taking different types of assessment, all right? You might be very familiar with the written exams, multiple choice, short questions, all right? That's only one form of assessment that you go through, all right? You will encounter things like what we call OSCE, all right, objective, structured clinical exam, where you go into a room and you see a patient, you talk to the patient, and the whole process, you're being observed. Okay, so this is another kind of assessment that you go through. Okay, so be open-minded, all right? It's not just about taking, no more 10-year series, Don't go and look for 10-year series. It's really about what you understand and be able to apply, and be able to apply that knowledge in front of a stranger. We expose you to actors who are like patients, all right? Sometimes they're really very, very good. They cry in front of you sometimes. So you need to learn how to manage that kind of situation. It's really exciting, all right? But, all right, it's really something that you probably have not encountered before. And at the end of the day, what we are trying to do is to allow you to achieve that competence, all right, to enter the profession. And you go through another ceremony here, all right, which is the pledge affirmation, where you kind of say a pledge and you become a registered pharmacist. Okay? And that leads you to the workforce. Okay, so what can you expect in the program? All right, it's a 4-year program, and along the way, you start learning about the drug. Maybe in the first year, you learn something that you might be familiar with, because we're still starting from the very basic, all the basic chemistry, biology. All right, so these are the things that you encounter. And then later on, you learn how that drug substance is made into a product. All right, it could be the injection, it could be the capsules and tablets and so forth. But more importantly, you learn about how to use all this medication in patients. All right, this is where the therapeutics or the clinical aspect comes in. In this new curriculum, we also like you to start thinking not about that single patient that you're looking after, but you're looking after a population of patients, right? Public health, right? All right, so population health and so forth. We like you to acquire the kind of system thinking where you will understand what are your roles as a pharmacist in the healthcare system. Okay, so that's really quite important, and this is where you will find meaning, right, in what you do. And of course, along the way, everything is kind of scaffolded. First year, you see all the foundations. Second, third year, you see all the systems, modules. That's where you learn to apply what you've learned in your junior years. Okay, so it's like a staircase. You take a step at a time. Baby step at first, and then when you get more senior, you're more competent, you may jump and you may leap, all right, to the top of the staircase. So this is what you can expect in the curriculum. I'm not going to go into too much detail because I'm going to be telling you more, all right, in week 1. So I think it's important that you know what your employers are expecting of you. That actually put you into the right mindset to learn, right? It's not about that A-level certificate anymore or the polytechnic certificate. Okay, it's about what your patients expect of you, right? Every patient will come to you and think that you are the one who can help me. You must be competent, right? You must know the knowledge. You must know the skills. Okay, you must be a competent practitioner. You must also be a team player, because nowadays you don't work alone. All right, you work with the doctors, you work with nurses, and so forth. Right, you learned about this interprofessional relationship. Right, so there will be a lot of opportunity for you, right, to acquire those skills. You need to be able to problem solve. We give you in the tutorials what we call collaborative learning workshop. We give you a case. Patient comes to you with this condition. How do you manage? All right, you create a care plan for this patient. But 2 weeks later, the patient comes back, didn't get well, got allergic reaction. What do you do? All right? You need to solve the kind of therapeutic problem for your patient. Okay, so that's what you learn. But of course, you don't do it all alone. We give you put you in teams. You discuss with your teammates and try to come towards a solution. Resource manager. There are a lot of things that you need to manage on your own. All right, the time, for example, is important, right? Because there's so many things to learn. You need to manage your time. All right. In the future, you will manage people. Right? You may be leading a team, for example. So how do you manage people? And that's where some of these soft skills will be important to you. And you need to get into the habit of learning continuously, because once you become a registered pharmacist, you need to demonstrate that you're still learning. Right? Every 2 years, you need to renew your license, and there's something called CPE, Continuous Pharmacy Education. All right? There's a point system. All right? Even for myself, all right, I still need to demonstrate that I'm still learning. I must get the points in order to renew my license. All right? So that's something, again, you need to acquire, and your employers are actually expecting of that. The more important thing is that when patients come to you, they're already not well. You should not do more harm to them. Right? You should not do more harm to them. And how do you do that? You need to know your stuff. Right? You must be sensitive enough to find out from them what is wrong. Ask questions. Know what questions to ask. All right? And that's where you can help. Okay? You don't just look at them, oh, just a rash, you take this. Right? So you need, to make sure that you do no more harm to the patient. Right? Because you're a healthcare provider. You're a care provider. Right? So this is important. Right? A lot of things that you learn now is also really because of this, that you don't want to hurt anyone. Right? Because to start off, they are really unwell. And more importantly, behave professionally. Okay? What about your patient? What do they expect of you? Right? You need to be competent. You need to be a good listener. Right? Listen and ask appropriate questions. When you ask appropriate questions, your patients know that you're caring for them. Okay? So that's important for you to learn. And always remember that they are providing a service. Okay? I mean, many of you have gone into a restaurant, all right? You have been served, right? So now you need to understand, how do you serve your patients better? You've got to think of that in the kind of role. If you are able to address the needs and find solution to help the patient, then your patient will gain your trust, will gain confidence in you, and they will come back to you. All right? They will come back to you. Again, professional relationship, something that you need to establish with your patient. So I think the more important question is, how do you get through these 4 years? I think that's your immediate goal, right? Like I said at the beginning, it's not easy, all right? It's going to be a lot of hard work, but also it can be quite fun, all right? The important thing is really to manage your time, build relationships with your teammates, build relationships with your seniors, and next year, build relationships with your juniors. Why do I say this? Because you never know that your seniors could be your employer. All right? When you need a job, your seniors is going to help. So this is the time for you to learn to build relationship. And I think there's nothing more important than being consistent in your work. Right? Don't leave everything to the last minute. all right? Because there's just a humongous amount of work that you need to do, okay? But more importantly, all right, you learn hard, but you also play hard, all right? NUS PS has organized a lot of activities for you. You've all come for the camp, and I'm sure you've enjoyed that, all right? So continue to participate in student activities. We will stretch you, right? We will stretch you in the classroom. You will go beyond your comfort zone, and that's where you learn to be resilient, right? So, and that's something that is really quite important when you go into the healthcare sector. Okay, like I said before, all right, look beyond your grades, all right? Enjoy the journey, all right? And more important is to make friends with all your teammates and your course mates. Now, I'd just like to end up with 2 other slides here to share with you what are some of the other things that are coming your way, all right? During the O week or orientation week, these are some of the activities that have been planned for you, and we hope that all of you will come for it, all right? In fact, some of them are compulsory. You will see how the department, all right, the head of department, Professor Christina Chai, will introduce the department to you. And then you go into a workshop on plagiarism. So this is compulsory. So all of you must come, all right, to this workshop. Then we introduce you to your teams, all right, and also the lab safety briefing. The lab safety briefing is important because there's a test that you need to pass, all right? If you don't pass the test, you won't be able to go into the lab for your practicals. Okay? So all this information will also be sent to you via email. Now that you're matriculated, so please use your emails, check your emails regularly to make sure that you're up to date, all right, with all the information that has been sent to you. Now, in week 1 for the pharmacy group, all right, we're going to have an induction week. So this is where we will give you more information about the course. All right, we introduce to you what to expect in year 1, okay? And we will run a simulated tutorial group with you, all right, which we call collaborative learning workshop, all right? There are 2 different conditions here. One is to look at how to manage acne, and the other one is how to use sunscreen, okay? Now, the other important thing that you will encounter would be on Monday afternoon, all right? This is where we will bring in the president of the Singapore Pharmacy Council and also the chief pharmacist of Singapore. We like to introduce you to these very important people. Again, is to start off that journey of developing your professional identity, right? We like you to interact with them, ask them questions about the profession, okay, and really, get into the thinking, the mode of thinking, all right, that you're going to be a health professional in basically 4.5 years' time. It's not a long time away, all right, and it will pass really very quickly. Okay, that's all I have for today. So basically, the important thing to note is please check your emails now that you have an email address. All right, so a lot of information will come to you via email. And for those of you who have friends who are not here today, you can share some of this information with them and make sure that they come for the orientation week. Right, so that's really quite important. Okay, so on that note, I'll be happy to take some questions if there's any. If not, then I will be outside as well. If you have any further questions, you could come and approach me outside. So on that note, keep safe, see you soon. All right, have a good weekend. See you during the orientation week. Thank you.